Hello, my name is Clint Nguyen, and today I'll be talking to you guys about tularemia. Tularemia is commonly known as a deer fly fever or rabbit fever. It is described as a hair-associated illness by a Japanese man named Hachiro Ohara. In 1911, in the United States, it was described as a plague-like or rodent disease by a man named George McCoy and a man named Charles Chapin. Rabbit fever is caused by a bacterium called Francisella tularensis, which can affect both animals and humans. The name of the bacteria was coined by a man named Edward Francis, who associated the bacteria with deer fly fever. F. tularensis is a pathogenic gram-negative aerobic coccobacillus bacterium. Although not much is known about the virulence mechanism of F. tularensis, it is determined in part by the ability of the organism to replicate within macrophages. Bacteria are then released from the macrophages following cell death by apoptosis. Here is a gram stain of F. tularensis. As you can see, it is gram-negative, and it is quite hard to determine if it's cocci or bacilli. Some modes of transmission includes insect bites by ticks, deer flies, and fleas. Another way it can transmit to us is by handling infected sick or dead animals, eating or drinking contaminated foods and waters, or inhaling infective aerosols. This disease is zoonotic, which means that animals can obtain the disease and can also transmit it to us as well. However, human to human interaction can't really transmit this disease, which is a really good thing. There are multiple types of tularemia, and they all are basically different from one another due to their point or their portal of entry. This one is ulceroglandular tularemia, and it's the most common form of rabbit fever. There are different signs and symptoms, such as a skin ulcer that forms at the site of the infection, as you can see in the picture here, and the swollen and painful lymph glands, as well as fevers, chills, headaches, and even exhaustion. The second type of tularemia is glandular tularemia, and people with glandular tularemia have the same signs and symptoms of ulceroglandular tularemia, but without the skin ulcers. As you can see from the picture here, it's of a little girl, but you can see her lymph nodes being extremely inflamed. The third type of tularemia is ocular glandular tularemia, and the signs and symptoms include eye pains, eye redness, eye swelling and discharge, and ulcers on the inside of the eyelid, as you can see from the picture here, and they're extremely sensitive to light. The fourth type of tularemia is oropharyngeal tularemia, usually caused by eating poorly cooked animal meat or drinking very contaminated water. This form of disease affects the throat, mouth, and even the digestive tract. Signs and symptoms of this include fevers, throat pains, mouth ulcers, vomiting, diarrhea, inflamed tonsils, swollen lymph nodes, especially around the neck. The fifth type of tularemia is pneumonic tularemia. Other forms of tularemia can also spread to the lungs, but these specific signs and symptoms include dry coughs, chest pains, difficulty in breathing. The sixth and final type of tularemia is typhoidal tularemia. Rare and serious, this is an extremely rare and serious form of tularemia, and some of the signs include high fever, extreme exhaustion, vomiting and diarrhea, a large spleen, a large liver, and pneumonia. Overall, since it is extremely difficult to diagnose tularemia, the general symptoms that the types share in common with one another is really just high fevers, extreme headaches, body pains, fatigue, ulcers forming on affected sites, and also inflammations of the lymph. Here we see there's a map of reported cases in the United States in 2014. One dot is basically placed in every county of residence for each reported case. We see that rabbit fever isn't really seen or reported in the states of Alaska as well as Hawaii, but it is more common in the south central United States, the Pacific Northwest, and other parts of Massachusetts. There's, as you can see here, there's a yearly reported case in the United States of rabbit fever back in 1950 all the way to 2014. It There is a general decline in the amount of cases in rabbit fever. However, this is just the number of reported cases. The numbers could possibly be more, but as you can see, there is a general decrease within as the years go on, as technology begins to progress and we learn more about the disease. We are able to combat it easier and better and have more preventive techniques to avoid getting the disease. Finally, this last chart is the age and sex reported cases of rabbit fever in the United States from 2001 to 2010. We start to see that more males get rabbit fever more than females. This is probably due to the fact that males are generally more of the hunters or more willing to go hunting as well as landscaping, which basically exposes them to these tick infested areas in which they can get the disease from. Also, we start to see that around the younger ages of 5 and 10 and the infant years, as well as from 40 to 60, that they're more prone to the disease, which shows that we really do need to take care of our children a bit more, as well as to be more attentive to what they wear, especially when going around tick infested areas. A really cool fact about rabbit fever is its possibility of being a bioweapon. It is considered to be a Category A bioweapon agent because of four things. It is highly infective, it is relatively easy to grow, it can be easily and widely spread, and is able to cause substantial illness as well as death. During World War II, many countries such as Japan, Russia, and the United States were researching on whether or not they could use rabbit fever as an aerosol biological weapon. But thanks to biochemical war laws and other laws regarding usage of biochemical weapons, hopefully that research has probably stopped. But if rabbit fever were to be used as an aerosol biological weapon, the World Health Organization estimated about if 50 kilograms of this virulent F. tularensis were to be dropped on about 5 million people, about 250,000 of those people would be incapacitated, whereas 19,000 of those people would end up dead. Regardless, there is always treatment for rabbit fever. Each case is treated according to the form of rabbit fever and the severity of it. Early diagnosis allows for immediate treatment with antibiotics. However, if it's a certain type of rabbit fever or a different severity, surgical intervention may be required to just cut away the infected tissues from skin ulcers or even to drain swollen lymph nodes. Rabbit fever can be effectively treated with certain antibiotics such as streptomycin, gentamicin, doxycycline, Oracea, vibramycin, and other types of antibiotics as well. There is a vaccine out there for rabbit fever that was used in the past for protecting laboratory workers. However, now it's currently unavailable and is not used for the general public. There are multiple ways in which you can protect yourself from getting rabbit fever. The first one is to protect yourself from insects, mainly just ticks, fleas, and deer flies. Most people in the United States get rabbit fever through tick bites. The best way to protect yourself from getting tick bites is whenever you're going to a tick infested area to be sure to wear long sleeve shirts, long pants, to tuck in your pants within your socks, to wear face protective gear, and other important factors. Also, the second way to protect yourself is to handle animals extremely carefully. Wear gloves and protective gear and wash your hands thoroughly with soap and hot water after touching animals. Also, to cook your meat very, very thoroughly. And the final way to handle animals carefully is to avoid skinning animals that you think are infected. Finally, the last important way to protect yourself is to protect your pets. Pets can contract this disease as well, and to prevent this, you can just provide flea and tick prevention, as well as avoiding contact with wild or dead animals. And to get immediate help if you think your pets are infected, go to your nearest vet and get them checked. Thank you so much for watching my presentation. Hopefully you guys enjoyed it. These are my list of references, so if you guys have any other questions, you guys can ask me this on Monday. Have a wonderful Thanksgiving break and take it easy.